About 9% of Oklahomans are Native American. Treaty obligations require they get free health care from the federal government. It's provided through federally or tribally operated clinics and hospitals or urban facilities partially funded by the federal government. In some parts of the state, those facilities are expanding or being built from the ground up. The newest one is in Johnston County.
Tishomingo is the historic capital of the Chickasaw Nation in Oklahoma. It's also home to the tribe's newest medical facility. The outpatient clinic's striking architecture pays tribute to Chickasaw heritage. The facility has 3 times more patient exam rooms than the old clinic and more than double the dental suites. There's an on-site physical therapy room the old clinic lacked. Plus, the new clinic has a pharmacy and its own state-of-the-art laboratory. There's also a digital x-ray suite, an ultrasound room, and mammography facilities. Lahoma Clark has osteoporosis that needs monitoring.
We're going to have the bone density machine over here now that we'll be able to use, which we never did have before either.
And what does that mean for you especially?
I won't have to travel to Ardmore to be able to do that. I always went to the Ardmore Hospital to get that done.
And how far is that?
That's at least 45 miles.
The clinic and the hospital the Chickasaw built in Ada serve the tribe's effort to make sure Native Americans within its tribal boundaries don't have to travel more than 50 miles for any health care service. The hospital and clinic are also part of a system of federal, urban, and tribal health care facilities, making health services accessible for Native Americans across the state, especially in rural areas. Federal facilities like the Indian Hospital in Claremore are operated by the Indian Health Service. There are 10 IHS clinics and hospitals in Oklahoma communities, including Clinton, Lawton, and Pawhuska. More than a dozen tribes operate an additional 38 hospitals and clinics in places as far apart as Miami, Atoka, and Newkirk. There are also urban Indian clinics in Tulsa and Oklahoma City. Dr. Franklin Thomas works in the emergency room of the Cherokee Nation's Hospital in Tahlequah.
For people who have access to the system, I think they get a great deal of benefit. So.
That's because Native Americans can get health care services at any of the sites without charge, says Chickasaw Health Secretary Judy Goforth Parker.
There's never a cost to the patient. We really feel that the costs were paid, by history, by the things that Native Americans gave up. And so there's this government trust responsibility that health care is provided, and so that's a pay.
We met Cherokee tribal member Blair Stevens of Sand Springs and her family while she was at the Cherokee Hospital in Tahlequah for a checkup. She's expecting her second child.
I'd say it helps out quite a bit, especially with getting all the maternity care for free and all the labs and everything. I know a lot of my friends have complained about how much it costs to have a baby, and we've just never really had to have that expense.
The Cherokee Nation operates the largest Native American healthcare system in the United States. It has a hospital in Tahlequah and 8 community clinics in places like Muskogee and Veneta. Like other tribes, much of the Cherokee's healthcare funding comes from the Indian Health Service. In fiscal 2012, the Cherokee Nation spent $236 million on health care. About $205 million came from IHS. Approximately $23 million was from other government sources, such as grants, and the tribe provided more than $8 million. Cherokee Principal Chief Bill John Baker says it's his tribe's policy to spend 5% of the profits from its casinos and other businesses on health care.
We're putting our money where our mouth is to catch us up to the growth that we've seen.
Demand for Native American health care has increased tremendously in recent years. When the Cherokee built its hospital in the 70s, it was designed to handle 30,000 patient visits a year.
And we had over 300,000 patient visits last year.
The Chickasaw have also seen a strong upsurge in demand.
We moved to the new hospital. It's nearly 4 years ago. We were seeing about 300,000 outpatient or 300,000 patient visits per year. And we're now up to about 700,000, and that's at the facility in Ada.
To meet the higher demand for services, the Cherokee are committing $100 million from its gaming and business profits to expand clinics and build a new 100-bed hospital in Tahlequah. The old hospital will be used for outpatient services like dental clinics, emergency medicine, and urgent care. The new one will be surgical suites and inpatient care. Baker says expanding its community clinics and building a new hospital will cut patient wait times for services and attract more healthcare workers.
We believe by building new clinics, we believe by expanding the clinics we have, by having a better workspace for the doctors, by having more equipment that it's proven in the past that when we build clinics that are up to snuff, that it's easier to recruit doctors to it.
While patients are never charged for services, if they have insurance, Medicaid, or Medicare, those policies will be billed to help cover the cost of care. Baker thinks the Affordable Care Act could increase the amount Native American healthcare providers collect from those sources.
It might even help us from the standpoint of more people having insurance, because we can bill their insurance companies, and if the small business gets subsidized to have insurance, that will be more of our patients that have a payer source.
Baker says that money could be used by Native American healthcare providers to improve or expand services for anyone eligible to be seen at one of their hospitals or clinics.